now I'm coming to the very important part. One question comes every attempt of NEET PG, if it is FMG or if it is INICET, in every exam, biomedical waste management, very important, right? Practically also in the hospitals, whenever you be working, you should know that what kind of things you are using in the hospitals, what it should be disposed in what kind of things. Okay, it's not like you are just disposing anything in the any kind of dustbin, right? It is not the case. So there are the rules and regulations, and there is very heavy penalty on the hospitals and which are not following the biomedical waste, right? So it is very important for us to know them. Okay, so look over here, this is a biomedical waste management chart. Okay, here what we can see is okay, we have what we can see, basically we are having the 4 boxes, 4 dustbins. Okay, or 4 bags you can see over there. One is basically your general waste. General waste is usually, either it might be having the, if you have visited the hospital, right, then it will be very easy to understand for you. So you will be, whenever you will be visiting the hospital, or try to visit the hospital, then what you will be seeing basically there, at every place, right, there will be the biomedical waste management dustbins, right? There would be the, either there would be the black color, or there would be the, in the black dustbin there could be the green color bag. So in that particular bag, that is basically for the municipal waste. For example, you are throwing the pencil or pen, or you are throwing the paper. Okay, so this kind of waste, you are throwing extra amount of food which is left over there. This kind of waste is actually going, this is not the hospital waste. This is, or if it can be hospital waste, but it is not that particular body waste, right? I would relate it to that. So that is the common municipal waste. That is common municipal waste, basically that is going in the black dustbin, or having the green color bag that can be disposed of over there. So what you are actually disposing in this particular thing: general waste, kitchen waste, okay, paper and tissue, water bottle, can, okay, household, uh, household dustbins also, they are having the black color category, right? This is the thing which, then comes important one, red category. Red category, what you will be disposing in the red category, right? In the red category you will be disposing the plastic and the tubes. Plastic and the tubes and the rubber, three things, remember. One is the plastic, okay, one is the rubber, okay, plastic, rubber and tubes. Plastic, rubber and tubes. For an example, Foley's catheter, it is a made up of rubber, should be disposed of in the red bag, right? For an example, gloves, okay, you examined your patient, you're having the gloves, don't throw it anywhere, okay, you will be penalized. Okay, so over here you need to actually dispose them off in the green, or in the red color category, right? For an example, you have a, you placed a for example, rice tube in the patient. Now you have removed the rice tube of the patient, right? Rice tube should be disposed of in which particular bag? That would be your red bag. That would be your red bag. Okay, I'm just taking the example. Then comes your yellow. Then comes your yellow category bag. Yellow is containing lot of things. You need, nobody will be asking you the black color category, because black color category, it is not even coming in the biomedical waste. It is just the municipal waste, right? They are actually, they will try to bother you, or they will try to confuse you between two things. One is the yellow bag, and another one is the red bag. Okay, this can be confused in some things, however it is easy only, but this can be confused sometimes. That's why they will be targeting this thing. Otherwise blue bag is very simple, and white is very simple. If you talk about the white one, container bag, basically it's not a bag, because usually it is carrying the sharps and all, it's carrying the needles and the cut glasses and all, right? So basically it is getting the needles and all, like sharps, is for sharps. Okay, so you can't put the sharps in bag. Okay, it can actually cause the injury and all of these things, right? So it should be, there should be a puncture proof container. For that there should be a puncture proof container. Okay, so usually there is a puncture proof container in only that particular white color transparent container, is there, usually white color transparent container. Okay, in that you are putting your sharps. Okay, if you talk about the yellow one, I was talking about the yellow one over here. Here you are talking about the infected waste. For example, your human anatomical waste. What could be the example of human anatomical waste? For example, right, placenta, right? For example, you delivered the baby, right? After that you deliver the baby, for example, okay, you will remove the gloves. After all, at last you will remove the gloves, should be disposed of in the red bag, in the red color category. Then you're having a placenta, right? After the delivery of the baby, you will be delivering the placenta also, that is in the stage 3 of the labor, right? You might have studied that in the obs-gynae classes. So in the stage 3 of the labor, there is a delivery of the placenta. This placenta should be disposed of, right? Obviously the Patient is not taking the placenta to their homes, right? They will take their baby to their home, but not the placenta, right? So placenta should be disposed of somewhere. Will you dispose of in the black category? No, you will dispose of it in the yellow category dustbin. Okay, that is the yellow. Okay, always remember that. Okay, for example, some tissue. Okay, you got some tissue. Okay, you were doing what? You were doing, for an example, debridement of some patient, right? Tissue was coming off. The tissue should be actually human anatomical waste should be disposed of in the yellow color. That is my motto over here. Okay, fine. Now solid waste could be there, anatomical waste could be there, okay, related to the body and all. Chemical liquid can be there. Okay, bed linings can be there. That could be the, the bed sheet are there which is soaked with the blood, for example, soaked with the sputum of the patient, soaked with the some secretions of the patient, should be disposed of in the yellow category. Cytotoxic drugs should be disposed of in the yellow category, right? Then if you talk about expired medications and all, expired and the discarded medications and all, they should be discarded in the yellow category, right? So there are a lot of things which can be discarded in the yellow category. Coming to the blue, category, it is not a bag. Basically, it's kind of a cardboard. It's kind of a cardboard. If you will be seeing over there in your hospital, okay, if you will visit the hospital, either you can visit government hospital or private hospital, everybody is following this. They must follow this. Okay, everybody is following this. So blue category, here you are talking about the broken ampule. Okay, you broke the ampule or the sister broke the ampule. Okay, and they will take the drug and they will inject it. Right now, what will happen to that broken ampule? It must go into the cardboard. Which cardboard? This is the blue color cardboard. Okay, so usually they are using the blue color tape. They're using the blue color tape on the cardboard to signify that this is the blue color cardboard. Okay, or blue color container or blue color bag over there. Okay, whatever you want to call it, this is the blue category. Understood. So antibiotic vials, for example, okay, any glass ampoules, okay, any vials, okay, the antibiotics are usually coming in vials. Okay, most of the drugs which are usually coming in, uh, basically in the ampoules and all, right? So they should be broken ampoules and all. They should be actually discarded in this particular category, that is the blue color category. Okay, except cytotoxic. Cytotoxic, that will be considered the yellow category. Okay, fine. Once we understood this, right? So basically, secured land, this is actually the black color category. Secured landfillings, it should be using secured landfillings for the red color category as well. Okay, for the yellow color, it should be actually deep burial. It needs the deep burial actually. Okay, blue color category, it can be disposed, it is recyclable actually. And it should be going into the sharp pit. That is for the this category, that is the white color container, right? So this is the particular case. Now I have a question for you guys. This is the blood bag. Obviously you can see in front of your picture, in front of your screen, that is the blood bag, guys. It should be disposed of in what category? Blood bag, guys. I told you that, after the blood transfusion, okay, you did the blood transfusion, okay, you hang the blood over there. After the blood transfusion, it is completed. Now there is a blood bag with you. Okay, if the blood bag has to be discarded, okay, it should be discarded in which particular category? In which particular category? Okay, cotton swabs and all, guys. Cotton swabs, which is having the human anatomical secretions, and all of this is cotton swabs and all, you will actually discard it in the yellow category. So cotton swabs also, cotton swabs and all of these things added in this particular category. Okay, cotton swabs and all. Okay, particular category. Cytotoxic drugs, right? Some drugs are which are cytotoxic, right? For example, anti-cancer drugs and all, right? They must be discarded if you want to discard it, or that, okay, or the expired medication you want to discard it, that you must discard it in the yellow color category. Okay, so sannyasi, red color category, Doctor Strange, red color category. Okay, I hope you are answering this, because I told you that, the plastic tubes and rubber, they should be disposed of in the red color category, right? And probably this is the plastic bag only, right? But in the blood bag, always remember, in the blood bag should always be discarded in the yellow color. Blood bag should always should be discarded in the yellow color, guys. Yellow color category. Okay, please discard it in the yellow bag. And that is the MCQ has been asked many times, because it creates the confusion sometimes that, it is made up of plastic, so it should be going in the red color category, but yellow bag is discarded in the yellow bag. Oh, sorry, blood bag is discarded in the yellow bag category. Yellow category, yeah, deep sugar, yellow category, yellow, yeah. Understood? So that should be very, very clear. If I'll be asking you, you are just assisting your orthopedic surgeon, and they remove the metallic implant from the body. they removed the metallic implant from the body. Can you tell me which category of this biomedical waste management you will use to dispose of this metallic implant? Okay, you are assisting the orthopedic surgeon. Okay, and orthopedic surgeon have removed the metallic implant from the body. Okay, let's say it was in the femur or it was something somewhere else. Metallic implant is there. Which category you will be using? BMW. Come on, guys. Come on, guys. This is the question which gonna come 100% biomedical waste management every year, every attempt of any MCQ, any medical exam, they will ask definitely this question. Biomedical waste management, very, very important. So blue category, I'm getting the answer. Excellent, wonderful. 5 out of 5. So deep Sudhar, Doctor Strange, Sannyasi, JK, Doctor Strange, JK. Yeah, very, very, very nice, very nice, excellent, guys. So it must be disposed of in the blue color category. So metallic implant, guys, I'm writing over here. Metallic implant, right? So metallic implant must be getting disposed of in your which category, that is